Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many produced by the Commission on Aging, of which I am an alum. This show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie. On this month's show, we're exploring the power of social connections for older adults and why they are essential to aging well, staying healthy, and living a longer, more fulfilling life. Joining me for this important conversation is Mr. Ken Stern. Ken is the founder and chair of the Longevity Project, which is an initiative dedicated to advancing research and public dialogue on how we live longer lives and how that's reshaping society. He also hosts the award-winning podcast Century Lives, produced by the Stanford Center on Longevity. Ken is the author of several books, including his latest, Healthy to 100, How Strong Social Ties Lead to Long Lives, which highlights the critical role relationships play in our overall well-being. In addition, Ken has appeared in leading publications such as Vanity Fair, The Atlantic, Slate, The Daily Beast, The Washington Post, and the Chronicle of Philanthropy. He currently serves as CEO of Palisades Media Ventures, a Washington, D.C. based thought leadership company, and previously served as CEO of National Public Radio, also known as NPR. Welcome, Ken.
Hi, Katie. Thanks for having me on the show.
How are you?
I'm good. I'm excited to have a chance to talk with you.
Likewise. Yeah. Ken, talk about the origins of your work and how it came to be.
So I got involved in aging and longevity probably pretty close to a decade ago, and that started with a conversation I had with a woman named Laura Carstensen, who's the founding director of the Stanford Center on Longevity, a professor at Stanford. And I thought I was going to have a conversation with her about aging, which for most people means, what do we do with all these old people? And she wanted me to have a conversation about longevity, which was, how do we rethink the entire life course for longer, healthier, more equitable lives for more people? And I thought that was just sort of an amazing way of thinking about our longer lives. We now live almost twice as long as we did 150 years ago. It's the greatest sort of, our advancements in life expectancy, one of the greatest advancements of the 20th century. But we really haven't rethought how we live these longer lives. And that brought me into the topic and eventually into the topic of this book, which was the importance of social connections to healthy longevity.
All right. Well, Ken, go ahead. Tell us about your book, and if we can see that.
Sure.
Healthy to 100. Talk about it. Yeah.
Okay. You want to show it? So I actually got interested in the issue of social connection and its relationship to health because of the podcast you mentioned. So I host this podcast, Century Lives. And we take it a 6-episode season as a sort of documentary podcast. And one season is about why some places in the United States, why people in some places live longer than the underlying demographic data says they should. And so the book actually began on a little street called O'Reilly Street in Presidio, Texas.
Okay.
So Presidio, Texas, which no one will have heard of, is a little town right across the bridge from Chihuahua, Mexico. So in a poor county, but it's also one of the longest lived counties in the U.S. Wow. It's sort of it's an anomaly. And I went there with my colleagues to try to understand why. And we didn't know why, and we thought, maybe it was food. It wasn't food. Maybe it was exercise. The principal told us he was considered an eccentric because he biked to work. It wasn't healthcare. The nearest hospital was 70 years ago. It was the way that people live their lives in multi-generational households and multi-generational neighborhoods, taking care of each other and living connected, purposeful lives. And everywhere we went for the season, that was the same story. The communities were stronger, the people lived longer because of the strengths of social connections. And that really sort of surprised me and got me interested in the topic of the relationship between social connection and health, and then how we should do it better here in the U.S.
So in the book, you mention again that it's not about, diet, it's not about exercise, but certainly it's about connection. And that realization came from you visiting that small town in Texas. Can you talk a little bit more about social health? You mentioned that in the book. Explain to us what that is.
Yeah, so I think of social health as being so first of all, I should say, It's not that those other things don't matter.
Okay,
Diet,
okay.
exercise, healthcare, genetics, they all matter.
Right.
But part of my message is social connection matters as much as those things do. Being lonely has been measured to be equivalent to smoking 15 cigarettes a day. So just sort of think about that and how we should put that. And the problem is when it comes to sort of public health in the U.S., we tend to think about those other things. And it's good to think about those things. We think about healthcare, we think about vaccine programs, we think about nutrition and exercise, but we don't talk about what I call social health, the infrastructure that's necessary to bring people together. And what we have in this country now is a disease of loneliness because all the things that have brought people together traditionally have been lost under sort of a tidal wave of technology as people use first televisions and now phones. All the institutions that brought us together have declined, and so has and in consequence, our rates of loneliness have gone way up over the last 50 years.
Can we talk about that a little bit more? Being in a digital world and being isolated, but are there benefits to technology in keeping us connected?
Well, yes and no.
Okay.
It's pretty clear that our loneliness crisis is driven by technology. There are use cases for technology that you can think about. I mean, these are communications technology. You can think of lots of use cases that technology brings people together. You can think about people with physical disabilities, hard to get out of their house. Technology can bring people together. You can think about during the pandemic, the way that allowed us to connect with others when we couldn't be face to face with each other. That's the hard part, because there are these really beautiful use cases, but in the global sense, it has really created this pandemic of loneliness. And I say to people, technology, even if it has some great uses, put us in this place. It's not going to take us out of it. We have to find out ways to be face to face with humans if we're going to have social connectedness like we used to have.
Ken, is it because we don't have relationships or those social connections, or are we just addicted to various devices and what they offer us in terms of the feeling of connectedness?
Yeah, so what's happened over, the answer is both. Like what's happened over the last 50 years is we spend more and more time alone. I have an 18-year-old son, my son's generation spends an hour less a day with friends than my generation did. The number of people, there are measures of social connectedness. The number of close friends you have. The number of people who report that they have 6 or more close friends has dropped by about 2/3 over the last 25 years. The number of people who report that they have no friends. 35 years ago when they first started collecting data on this, 2 or 3% of people said they had no close friends. That's a very sad story, but it's not a lot of people. Today, it's something closer to 20%. I mean, it's and it's really sort of technology. Your friends are your phone. You spend more time with your phone. I mean, you even have digital friends now. Those things have been replaced human connectionness.
And the addictiveness to the like or the share or the subscribe or the heart, whatever that is.
Right. The algorithms are built to be addictive, right? That's not a secret. I've done it myself. I started my Instagram scroll, and 30 minutes later I look up and I'm like, what the heck happened there? It has replaced human connection in ways that I think have hurt our health and hurt our communities.
Okay. There's science behind the work that you've done, and there was a project at Harvard. I would love for you to speak a little bit more about that.
Oh, yeah. So one of the challenges of talking about social connection, it's easy to understand sort of the relationship between smoking and health. It's easy to understand the relationship between nutrition and health or exercise and health. A little hard to understand social connection. So I'll tell you sort of 2 things. One is, and the one reason it matters is because we've been bred since beginning of humankind to understand that being lonely is dangerous. Being part of a group is safety, means safety. So at our most basic level, when we're lonely and when we're chronically lonely, that leads to chronic stress. You're sort of flooded with danger signals throughout the body, and chronic stress is correlated with cognitive decline, poor health, cancers. You can even see at the cellular level. Researchers have actually looked at people who are lonely versus people who have a high degree of social connection, and they have different rates of cellular aging. The study you mentioned, so you can that's the sort of relationship between loneliness and social connection and health. But there's a study that you're referring to called the Harvard Study of Adult Development, launched in 1938 in the middle of the Depression, when researchers at Harvard decided they wanted to try to figure out the secrets to happiness and health. Kind of a big aspiration. So they recruited about 400 men, half from Harvard, including John F. Kennedy, and half from poor sections of Boston, with the idea of tracking them and seeing like what really drove happiness and health. That study is still going on. 88 years later, they're not tracking those people anymore. They're tracking their kids and grandchildren and great-grandchildren. And they've followed them through, wars and jail and divorces and all sorts of ups and downs. And the guy who's now the director of the study, the fourth director, says that the entire sum of their knowledge over almost a century is health and happiness comes from the quality of the relationship to the person next to you. Of all the things, income, education, access to health care, food, nutrition, all those things, it boils down to the quality of social connections that you have. It's sort of an amazing finding over almost a century of research.
And then perhaps the quality of those relationships, would it also stand to reason that they impact other social determinants of health, whatever your relationships are?
Yeah, so it's really interesting, Katie, because I'm not sure what direction it goes. You actually see in the relationship data that people in more difficult neighborhoods have less social connections. Might be because of they don't have third spaces where people meet, maybe because of dangers, and maybe because you don't have enough money to buy your free time. And that all adds up to a lot of disparities in how long we live. In Washington, D.C., where I live, if you go to Georgetown, life expectancy 92. You go to Anacostia, 6 miles away, life expectancy 67. That's a lifetime of difference, just over a few miles.
Yeah, but you also have like walking communities in your neighborhood, access to services and programs, and people who have, been there for a longer period of time. So there are generations of families in that particular pocket of which you reside.
That's right. Those all things, and those things all add up to very different lives.
Okay.
Yeah.
Well, let's think about people who may have lost a spouse, or they're retired, or they relocated. A lot of older adults are relocating, whether it's to a warmer climate or closer to their children who can help take care of them. What do they do?
Yeah, so my book is really about social connection in the second half of life.
Okay,
and there's a huge challenge. There's
Okay.
a huge challenge that starts with retirement, because a lot of people sort of walk off a work cliff. I mean, our relationships are built by proximity. That's sort of the science of friendship is largely about proximity. And that's why relationships from school and work and used to be from churches and unions seem to be so important. You lose a lot of those things as you age. And one of the challenges we have is how to replace them as work gets less important or less prevalent as people move away. And people do it in different ways. Part of my book is to tell sort of the story of social health on a side level, but also to help people make some choices about the second half of life. And it starts, I think, Katie, I would say, with the notion of the second half of life is as important, can be as important and valuable and purposeful as the first. We're actually taught by society that, the years past 60 or 65 are years of decline and winding down. It's not really true. A lot of social data around that. There's lots of ways to be purposeful and engage, and that could be in work, that could be volunteering, that could be intergenerational relationships, could be through lifelong learning. There are tons of opportunities for people if we make it available and people know where to look for them.
What you just mentioned, the latter half, is definitely integral to the work of the commission and making sure that people know that they have a purpose. I've talked to a guest before, and they said once they retire, they don't call it retirement, they call it graduation. So graduating to the next. That's
Yeah.
very interesting. You've done a lot of studying. You're very traveled, cultured, and you've been to Japan and Singapore and Spain, and you learned a lot from how they live healthier lives. What you learned, what can we adopt here in Montgomery County specifically, or in the DMV region that could help us to be healthy to 100?
So I'll start with, so I went to 5 countries for the research for this book.
Okay.
Spain, Italy, Japan, Singapore, and Korea.
Okay.
And they all actually approach aging and the second half of life differently, but there's some connective tissue. And the first of which is they all understand that social health is public health. So at the, when they think about, when the government, when society as a whole think about that second half of life, they think, of course they think about healthcare and access to food and exercise, but they really start with the notion of social health. How do we ensure that people after 50 or 60 or 70 or 80 or 90, median life expectancy for women in Japan is 90. So there's lots of years of life, but they start with the notion like, how can we help people make sure that those years are as valuable, purposeful, and meaningful as the first? And that's a public policy, that's a cultural endeavor that exists in those countries in ways they don't exist here. And we can learn some lessons, as a country, and as communities, as Montgomery County.
So social health, it feels like the terminology is kind of new, but what's been around has been for a long time, having those lasting relationships. In addition to Healthy to 100, how else can we get the word out about that and socialize this among people? Like post 50, post 60, post 70, whatever your post is, you can still have a very meaningful life.
Yeah, I think there's a danger when you write a book like this. It's a fun book to write, hopefully a fun book to read. There's a danger that everyone in other countries are doing it right, and we're doing it all wrong here. And there's some truth to it, but there are things there are big challenges in other countries, and there are amazing things happen here. Organizations that are working with seniors every day, seniors who are volunteering, the old taking care of the old. I see it all over the place. There are clubs and engagements and efforts to bring lifelong learning to people. It happens in lots of places, and individual stories of contributions from people in their 70s, 80s, 90s, and even beyond. I think sort of sharing those stories, rising up those groups from a governmental level, I make the case that we should put more resources into helping those groups engage people after the age of 50. But also it's about shifting cultural norms. I mean, one of the challenges we have is the fact that it's actually harder for people over the age of 50 to find meaningful work. People in over 50 face tons of ageism in the workplace. I think some AARP's done research that about 3/4 of workers over 50 have either experienced or seen ageism in the workplace. That's illegal. We should be calling it out, but we treat it as normal, and we should be calling out and supporting companies that advance the cause of older workers. That's just one example of many things we can do to support people in the second half of life.
I'm glad you mentioned that. The business community definitely has a role to play here. And I'm sure you've navigated, those waters throughout the tenure of your career. How would you envision, partnering with some of those Fortune companies, or maybe not the Fortune, the large and the smaller businesses to socialize social health?
Yeah.
To educate them about social health.
Yeah, so there are ongoing efforts.
And to decrease ageism in the workplace.
Yeah, so there are ongoing efforts, I think, to engage the business community on both ends. One is the power of the over 50 consumer, which controls most of the disposable assets in the country.
Yes, they do.
And yet advertisers are still focused on the 18 to 54. It's like locked in their heads. So there's efforts to I think progress on the notion of older people being should be taken seriously by consumer companies. And the other place, which I think is a harder nut to crack, is the notion that we sort of have a cult of youth in this country. That's not a secret. And that starts with the notion that younger workers are somehow smarter, faster, more technology effective than older workers. And some of that's true. in terms of probably access to technology. They're more digital natives. But older workers tend to have lots of other things that they offer, including wisdom, experience, years of
Institutional
knowledge.
knowledge, yeah.
Right. Companies that figure out how to fuse that together are the ones that win. The challenge, I think, is companies yet don't feel the workplace pinch yet of what happens in super aging countries, which is declining labor force in the 18 to 64-year-olds, which is sort of the traditional labor force. You go to Japan and Korea, there just aren't enough younger workers or workers in those age. So they love older workers. That's going to happen here, but it's not going to probably happen until companies start feeling it. It's going to happen. There's new data just came out yesterday, or by the time you see this, last month, on declining birth rates. The birth rate continues to plunge in the U.S.
I heard that.
Yeah,
I did.
that means fewer younger workers as life expectancy continues to increase. More older workers. Companies are going to have to grapple with that reality
And adopt them a part of their leadership principles.
That's right. That's right. Yeah. And the sooner they do, the better off they'll be. And the smart ones are looking at it now. Others will follow.
Speaking of business, let's also pivot more to government and local government.
Yeah.
What lens should local government be taking, and a group like the Commission on Aging, which powers this particular programming?
Yeah. So first of all, I think the challenge is love talking about commissions on aging, and next week I'll be out talking to one of the area agencies for aging in Illinois, because they play such a pivotal role in terms of services to an aging country, which is what we are and what the world is. But two things I would say. One is to understand that aging is not something that just happens to people once they hit 65. We're aging all the time. And part of the challenge is to think about age. Some of the most pivotal years of your life in terms of whether you're going to age well are from 1 to 3. So I would say, when we think about aging, let's think about the whole arc of aging. And let's also think, as I know the commission here does, let's think about how, not just about serving that population, but how that population can serve the rest of the community, right? Those are valuable years, but we're sort of taught to think them as years of decline. How do we help people plan for years of service, contribution, meaning? And that has to start earlier than, once you hit 65 or 70.
Wow, that's interesting. So as we're thinking about social connections, how does that play a role in preventative healthcare?
Oh my goodness, it is like, I don't know the right analogy, but first of all, let's establish one fact, which is health takes place outside the doctor's office.
Wow. Say that again.
Health takes place outside the doctor's office. It's not an original thought to me. I mean, there's tons of research on the relatively small role, not small, but relatively small role that the healthcare system plays in life expectancy and healthy aging. The more you can prevent, the more you can stay moving, active, engaged, the longer you will live, and the more time you will spend outside the doctor's office. Social connection plays a huge role in that. It's almost like a protective mechanism. The more socially connected you are, the higher likelihood that you'll be healthy and won't need access to healthcare in the way that others do. And that's, I mentioned earlier, you see the difference on a cellular level. It's not just like this feel-good notion that being social connected makes you feel better. It literally has an effect on the most basic element of your body. And it's something, as everyone thinks about their nutrition plan or their exercise plan or their access to doctors, they should be thinking about their social connection plan in the same way with the same type of gravity.
Ken, you're so smart. Through all of your research, has there been anything that surprises you or has surprised you? Something that you are struck by? Yeah. Just curious.
I'm constantly struck by I'm constantly learning. I mean, that's actually, which is a good thing, right? That's actually, lifelong learning is highly correlated with healthy aging. I'll tell you one thing. So I go on for the things I learn, and I come back tomorrow and I'll tell you the things I learned today and tomorrow. But one thing that I saw as a commonality that I didn't really expect in all the countries I went to for this book, I continue to see, is the importance of intergenerational relationships to healthy longevity and to social connections. I have a friend named Mark Friedman who says the generations fit together like pieces of a jigsaw puzzle. And all those, the healthy societies have really figured out, either explicitly or implicitly, that the more you put the generations together, the stronger all generations are going to be. For older folks, it's about purpose. It's about positive attitudes about aging. For younger folks, one of the strongest correlates of success for an at-risk youth is a relationship with an unrelated older adult, a mentor or a friend. Those things help all sides of the communities. And other countries work very hard to make sure that the generations are constantly interacting in housing and in education and at work. And we take a different view. I mean, you talked about people moving away to warmer climates. That's a uniquely American thing. This idea of active aging communities, that's an American invention of the 1950s. We didn't do that before that. Other countries don't do it because the idea of moving to places where other generations don't live doesn't make sense in the context of healthy aging. I've been to a lot of those communities. There's a lot to like about them, but the absence of young people, the youngest and the oldest together, something that other people have figured out is really important, is a real building block of a healthy society.
Thank you for mentioning that intergenerational piece. Ken, how can we stay in contact with you?
Thank you for that question, Katie. Lots of different ways. So I mentioned my podcast, Century Lives. You can follow us at our website, longevity-project.com. We have 2 newsletters that come out every week. One's on social connection, one on longevity and aging. And I'll make a special call out to our Instagram channel called Grand People, where we tell this every week. We tell stories of people over 60, 70, ordinary people, but just doing extraordinary things, not breaking world records, making contributions to their community, and their beautiful stories. And you can find us at Grand People on Instagram.
Grand People on Instagram, and they can follow you on LinkedIn. I know I'm following you right now. They can also purchase the book. Healthy
so many ways to get to reach
100.
Me. Yes, thank you for that plug.
Absolutely. You know, we have run out of time, Ken, but I can ask
soon.
you soon so many more questions. I know the commission will bring you back. They're having an upcoming public forum that I know you've been instrumental in helping to shape the direction of that, so thank you for that. But I've certainly enjoyed our conversation.
Thanks for having me.
Absolutely. Well, that concludes our program for today. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for seniors in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.